In this episode of Ask Dr. Zach,
I have had skin cancer 5 separate times. I would lie on tin foil covered in baby oil. Now my daughter does go to a tanning bed. Is that different than lying in the sun?
and later,
I've had a bladder infection for 1 year and 3 months. From here down and sometimes across here. Unbearable.
then on the doctor's orders,
Gluten is a protein that people with celiac disease can't have. It makes them really sick. But if you don't have celiac disease, you can have gluten.
In the ER, I deal with trauma and life-threatening situations every day. I've seen it all. I know firsthand that accurate medical advice can save lives. I'm Dr. Zach, and I'm passionate about empowering people to take control of their own health. This is your chance to ask me health questions. No question too big, no question too small.
Today we're going to be discussing a topic that each of us or a loved one has dealt with at some point in our lives, and that's cancer. While we're making progress in the fight against cancer, the number of those still being diagnosed with it is still far too high, and millions of people die too young every year as a result. To learn more, let's take a look at the Blazen medical animation.
The human body is composed of millions of cells that vary in size, shape, and function. Cells are the building blocks of all the different tissues within the body. In healthy tissues, new cells are created during cell division, a process called mitosis. When cells become old, they self-destruct and die, a process called apoptosis. A delicate balance must exist between the rate at which new cells are created and the rate at which old cells die. Cancer develops when the balance is disrupted and cells grow out of control. This disruption can result from uncontrolled cell growth or loss of a cell's ability to self-destruct, resulting in a mass of cells or a tumor.
And we'll be right back with a lot more about cancer.
up next,
I have had skin cancer 5 separate times. And I would lie on tin foil covered in baby oil. My vanity got the best of me.
all this and more right after this short break.
See all the blotches. That's all sun damage. Sun damage. I'm really very, very nervous about skin cancer. My vanity got the best of me, and I would lie on tin foil covered in baby oil and iodine so that I could literally fry and obtain a form of a tan. It wasn't a tan because I would burn. I would have huge burns and sunburns, and then I would peel, and then I would have scarring, and I would have freckles, and I have had surgery for skin cancer 5 separate times. After my last bout of this, I have been asked to wear this. This is my mother, and this is her wedding picture, and she had the most immaculate, white, gorgeous porcelain skin. And I have to say that I did as well, and I think I passed that on to my daughter. And she has also inherited that lovely porcelain white skin. My daughter does go to a tanning bed, and I really want to know, is that different than lying in the sun? I'm hoping Dr. Zach will tell me something that will alleviate my fears of my daughter going to tanning beds, or he would give me some information to compare the disastrous results, if any, from a tanning bed as opposed to frying on tin foil.
Now it's time to ask Dr. Zach.
Welcome, Elizabeth.
Hello.
Hi. Thanks for being here and sharing your story. So tanning beds are basically just as bad, if not worse, than the sun. The the power of the rays, so it's mainly UVA radiation. So UVA and UVB are the two forms of sun radiation that cause tanning and burning. A is more sort of the skin aging, B is more the burning, but they both cause damage and skin aging, and they both lead to cancer. And tanning beds, like the sun, give off about a lot of UVA. The majority is UVA, but it's about 12 times as strong as the sun, actually. And it increases the risk of the various skin cancers like squamous cell. It increases the risk by about 2.5 times. Basal cell carcinoma, it increases the risk by about 1.5 times. And for melanoma, if people are exposed to tanning beds in youth, the risk of melanoma goes up by about 75%. So any way that we can get your daughter to hear this, and especially, part of the problem with having beautiful porcelain skin, which you did and she has, is that you're more susceptible to skin cancers, right? Especially melanoma. It tends to be very white-skinned people, especially who freckle, especially blonde hair or red hair, especially. Those people are really susceptible to skin cancer. And melanoma being the most aggressive of the skin cancers. So let's start with that. I also wanted to ask you the type of skin cancer that you had experienced.
I've had a number of basal cell, but this was done at the Mohs Clinic, and it was melanoma, as was this big one here.
Yeah, okay.
And is it hereditary? My mother's face went piece by piece.
Oh, did she have skin cancer?
Yes.
Okay. Well, it's not hereditary in the sense that you get it just from genes, but unfortunately, your daughter is at increased risk just because of the skin type she has. It puts her at increased risk for getting skin cancer, so she needs to be really cognizant of that. And so I'm sure you know the different things that have to be done. Now, you mentioned your doctor told you to wear a hat.
Yes.
Yeah, so.
And a huge 70 skin SPF.
Absolutely. So you have to look, and make sure when you look on the bottle to make sure that it has broad spectrum so that it blocks both UVA and UVB. And of course, the best way is through shade of some kind, so either a hat or under a tree or something. And so you said you had basal cell and squamous cell and melanoma. So
yes,
basal cell and squamous cell.
The less ones were on my back and my arms, but these were the bad ones.
Yeah, the melanoma, right?
Yes.
So melanoma is less than or about 4% of all skin cancers, but it's really aggressive. It accounts for over 75% of deaths from skin cancers. But you did go for the treatment that these days is really the best treatment, is Mohs treatment.
Mohs.
Yeah, and that's, there's some centers in all the big cities, they have specialized dermatologists who do this surgery, which has been shown to really decrease. In terms of tips, you may know this already, but for people who don't know, there's some tips, like if they see a mole and they're worried about it, things specifically for melanoma, there's sort of an A, B, C, D, E acronym. So basically, A is for asymmetry, if the border is not symmetrical. B is for if the border is irregular. C is for color. So basically, if it's black or blue, those are more common with melanoma. D is diameter, so more than about 6 millimeters. And E is evolving, sorry. So basically, if it's changing. So, anything in the body that you're worried about, if it's worsening, is of concern potentially. So yeah, you want to go and get checked out. But if you're worried, or if anyone else out there is worried, you can always look online. There's actually good guides. Make sure it's a good place, like a dermatology association or a university or a government website, to get information about what to look for in terms of if you see a mole and you're worried about it, what might make it a dangerous mole. But if you're ever concerned, certainly you already have a dermatologist. I mean, ultimately, the ultimate thing to do is to go in and get it checked out.
Thank you.
Oh, it's my pleasure.
Now, Dr. Zach's prognosis.
Elizabeth came to speak to us about skin cancer. She's concerned because she's had some skin cancers, and she's concerned about having more, but even more so because her daughter goes to suntan booths. Now, her daughter has to stop absolutely, because those things are worse than the actual sun in terms of causing skin cancer. She's got to stop that. She is at high risk because of her light skin color, her fair skin. So she needs to find the shade, she needs to wear big hats, and she needs to cover herself up with either clothing or with high SPF, UPF sunscreen.
Still ahead.
I've had a bladder infection for a year and 3 months. Pain from here down and sometimes across here. from here down and sometimes across here. I've had a bladder infection for a year and 3 months. I've received 15 prescriptions so far. This is a list of some of the stuff that I've been taking for the past 15 months. Macrobid, ciprofloxacin. I can't even pronounce half of the stuff. It only delays the feeling, and then it is right back.
For me, it's frustrating to see her in the pain all the time. She isn't able to enjoy life, and we aren't able to do as many things as we would like to.
I'm in constant pain. In the past 15 months, I've been to the emergency room twice.
If she's in that much pain, she wakes me up and she says, I think I need to go to the hospital, at which point in time I jump out of bed and put on some clothes and say, let's go.
I've done everything like in the books, like drink a lot of water, have a lot of cranberry juice. I'm forever looking for new ideas. It just doesn't seem to go away. This has been going on since April 2014. Dr. Zach, I hope that you can help me because I'm at my ends with right now.
Now it's time to ask Dr. Zach.
Welcome, Beryl.
Thank you.
Thank you very much for coming in. So I hear your frustration. It's been a long time.
Yeah.
Absolutely. Let me start by asking you one thing. Do you have a doctor that follows you?
Yeah.
Okay. So, and that person knows about what's been going on?
Yeah.
Okay, good. But so far, no diagnosis yet, no cure yet.
No cure, but he has referred me to a gynecologist.
Okay. So he thinks that's where it's coming from?
Yeah, and I've also been to a urologist who
Oh, you have,
said that it wasn't anything to do with my bladder.
It was not?
No.
That's interesting. Because they keep giving you all those, I saw that list, all those antibiotics are bladder infections antibiotics.
Yeah.
Do you know, were there actually bacteria growing in the urine when they tested it?
E. coli was the results.
Yeah.
And at the hospital, they said it was like 10%.
Okay.
And my family doctor said that low a percentage, they never usually even treat.
Yeah.
But my gynecologist think it's drying in
that area that's causing the pain.
Yeah.
Which may well be. The only thing that's atypical about it, I have to say, is because you said it starts in the upper part of your abdomen, right?
Yeah.
You were mentioning that. And then it goes down.
Yeah.
Is more pain in the lower part?
Under here, yeah.
Okay, so is that really where it seems to be focused?
Right now, there's no pain. I saw a gastro person yesterday.
Okay, good.
And I had
Gastroscopy.
gastroscopy yesterday.
And,
And I've been on Tectol, TEC.
Oh, yeah, an anti-acid
Yeah.
medication.
And really, I'm feeling better than I've ever felt before.
That's great.
Yeah.
Part of the reason it may have taken so long, it's hard to know, but because of the symptoms are a bit atypical, and maybe you had more than one thing, that's the other thing. The fact that you had pain in the upper abdomen, that does suggest more of a stomach issue, but then if you're having discomfort lower down, in the pelvic region, that sounds more gynecologic. And then if you're growing E. coli in your urine, that sounds more urologic. So that's the sort of thing that can take a while to figure out. So now you're feeling pretty good?
I'm feeling pretty good, but at the same time, I'm wondering, is it going to come back?
Yeah, well, it's always, it's always a concern. So when's the last time you had any symptoms? When's the last time?
Well, the burning never completely go away. There's a slight amount.
That's when you urinate? Or all the time?
All the time.
Okay.
Yeah.
Yeah. Well, if there's burning specifically when you urinate, that goes more with a urinary tract infection. But if it's there all the time, then it suggests something else, like something more pelvic or vaginal, something like that. So it's good you are being followed up. Once you have a diagnosis and you deal with it and you treat it, it shouldn't come back. That's the thing. I think what's been happening is you've been treated with all these medications over the past 15 months, and it doesn't seem like any of them have really dealt with the underlying issue. And also the other thing is, it sounds like you may have had two things, because you felt better with the stomach medication, which suggests something with the stomach, like dyspepsia. But did they do any tests for a bacteria called H. pylori in your stomach?
Yes, I just had that, like the gastro doctor.
He did the test or he did the treatment?
She did the test.
Okay.
And it came back that I have H.
Okay.
So I got some antibiotic for that.
Yeah. So that's another big one, you know. That's a big cause. It's only the past few years, actually. They used to think that ulcers, stomach ulcers and gastritis and irritation of the stomach was all stress-related, or at least large part. And a few years ago, they found this bacteria that's very, very much related to ulcers and stomach problems. So now it's very treatable. So did they put you on, they probably put you on a couple of weeks of 3 medications?
Yeah.
Yeah, but that's good. Yeah. I mean, these are all good signs, you know, the fact that you actually have something, you have a diagnosis now, there's a bacteria they found, it's probably causative, they can actually treat that. Yeah. Until that time when they're kind of saying, oh, maybe it's a urine infection, we'll throw another antibiotic at it.
Yeah.
That's obviously suboptimal because you don't really have a diagnosis, you don't know what you're treating. So, I mean, stick with that gastroenterologist, it sounds like that's right.
Yeah.
And the gynecologist too, because the truth is if it's a stomach issue, it shouldn't be giving you that pain lower down, you know? Usually stomach, and I'm talking about the actual stomach, not the rest of the intestine, that's really quite high up.
Yeah.
So if you're having the discomfort lower down too, and the urological problem has been ruled out, then the gynecological problem is probably where it's at. You know, once you find the cause and treat it, it shouldn't come back. Okay. It's just a matter of not throwing any drugs at it anymore that we don't know what they're doing. Okay?
Right,
Very good.
Thank you very much.
Now, Dr. Zach's prognosis.
Beryl came in with abdominal pain. She's had it for a long time, and they've been throwing a lot of antibiotics at it, and unfortunately, it seems like that wasn't treating the cause. Now, finally, she seems to be getting some relief because they found that the cause seems to be twofold. Number one, having to do with her stomach. They found the H. pylori bacteria, which causes ulcers, and they're treating it. And number two, there may be something gynecologic going on as well. The point here is keep going back. If you haven't gotten relief from your symptoms, the doctor may need to do more tests, but eventually, once they find the actual cause, they can treat it.
Don't go far. We'll be right back with the doctor's orders.
Doctor's orders, have some gluten. Going gluten-free is really popular these days to treat all sorts of symptoms. Gluten is a protein that people with celiac disease can't have. It makes them really sick. But if you don't have celiac disease, you can have gluten. You don't have to. If it makes you feel better not to have gluten, good for you. But consider the fact that it's probably the all-powerful placebo effect that's making you feel better.
Now, it's time for you to ask Dr. Zach.
And now's the time on Ask Dr. Zach when we get to some questions from the audience. First question, please.
Hi, my name is Sandra and I'm in sales. And my question for you, Dr. Zach, is in May, I fell in my garden and I fell back and all my weight landed on the shoulder. I was sure I had broken it. After spending 3 hours in emergency, they said, you damaged your rotator cuff and you tore all the tendons.
Oh boy.
My question to you is, how long does it take to heal?
There's no great answer, because it's so variable. Some people, it's a few months. Usually people get back to the function, like their regular function, or as good as it's going to get in about 6 months. The shoulder is one of the worst joints for getting frozen if people don't use it. If it's continuing to bother you a lot, if you can take something for pain or an anti-inflammatory, that may help as well. But if it's not getting better, the ultimate test to really see exactly what was torn, because it's so complicated, is an MRI. Sometimes that's necessary, and then they can say, okay, you have a partial tear of your supraspinatus, for example. There's lots of different muscles there, and this is what you should do about it. And sometimes they actually do surgery for severe rotator cuff tears. Now, hopefully you don't need that, but the other thing I would say is, while you're still having pain, do exercises, but try not to do things that strain it. Because part of the problem is, until it's totally healed, you are susceptible to re-injury.
And you said that could take 6 months?
It can, yeah. It can take 6 months. It can take even up to a year, depending on how much you're using it and the exercises that you're doing.
Great. Thank you.
Thank you. Thanks for that question. And last question, please.
Yes, Dr. Zach, my name is Judy. I'm a letter carrier. Recently, I've had a gallbladder attack where I've had it removed without any warning. It just came on. So it was kind of, I didn't know what was happening, but this was the result. And since I've had it removed, I've had 2 previous attacks within the last maybe 14 months. So now I'm scheduled for an MRI. And I'm very worried about, because I'm still having persistent pain.
Yeah.
And I'm wondering what can be the cause of this, or what's could become of this, and is there a way to kind of make this stop?
Yeah, absolutely. So what you're describing is something that we call post-cholecystectomy syndrome, or PCS. It's just a fancy name. It just means pain after you've gotten your gallbladder out. And it affects about 10 to 15% of people. And the problem is, and this is probably why you're still suffering from it, there are many causes for it. Sometimes, actually, a piece of the gallbladder actually regrows. Sometimes you can still have some sludge. Even though you don't have the gallbladder anymore, you can still have some sludge and some blockage of the ducts, the gallbladder ducts. Because what happens when you have a gallbladder attack, or biliary colic as we call it, is you have a blockage. Some of the bile makes a stone and it blocks a duct. And a duct is just like a little tube, but when it's blocked and it's trying to get through, it causes tons of pain. And it has to be taken out emergently when it's blocked, and there's also associated infection. That's what we call cholecystitis. If it's just gallstones and pain, they take it out eventually, but not emergently. Sometimes it's just a matter of a dietary adjustment. Sometimes they can use a medication. And also there's another procedure which they may talk to you about, which is called an ERCP, an endoscopic retrograde cholangio ARCP, pancreatography, and where they actually will go in through the mouth and they can take a look with a scope. They can see the ducts and see if there's any blockage there. Definitely follow up with the doctor, get these tests done, but also see if you notice any kind of trigger. So obviously when you have your gallbladder, certainly fatty meals are supposed to be a trigger for causing pain. But see if there's anything dietary that you can notice that actually makes things worse, because that will give a good hint to what the actual cause is.
Great. Thank you very much, Dr. Zach.
Thank you. And that is all the time that we have for today. I want to thank the guests for coming on and speaking about their experience. And I want to thank the audience for some great questions. Hopefully they got some great answers as well. Be sure to join us next time, again, on Ask Dr. Zach.